Okay, we're just going to do an extra-oral examination of the patient. Obviously, when the patient walks into your surgery, that's the best time to have a look. And quite often, when the patient walks in, your first few seconds can tell you an awful lot about the patient without even putting your hands on them. So we'll get the patient in. Carol, that's good to do. Okay, as Carol walks through the door, just a brief look at Carol can tell you an awful lot. First of all, her gait and whether she's holding her head in a certain way, whether her lips drooping, whether she's has a pain face or something like anything like that that is slightly different, slightly off the norm. You'll pick up immediately. So already you've probably done about 30% of your extra-oral examination without the patient even reaching the chair. And just by talking to them, you can tell. Good morning.
Morning.
It's afternoon, actually, isn't it?
Yes.
So, yeah, she can talk normally. She's not holding her lips in any particular way. Things are looking quite normal. Remember, what you're looking for is things that aren't normal, and that's about it. You're trying to pick up abnormalities. So, Carol, would you like to take a seat, please? Thank you. How are you doing?
I'm fine, thank you.
Okay, so I'm going to face the patient, and I'm just going to just a little bit of chit chat, things like how are you doing, any problems at all, or anything else that you want to talk about. And already I've done now around 50% of my extra-oral examination. So what we're going to do is start with doing a check-up today. So what I want you to do now is just pop your head on the headrest while we relax. What you're looking for in the face is things that don't look quite right, and things that you will pick up on is anything that is odd. And for example, if the patient has a bilateral rash on the cheek, that's a butterfly rash, that actually is a sign of lupus, so you can pick up systemic lupus erythematosus very quickly just by looking at a simple thing like that. People that work outside tend to pick up little ulcers here, or on the nose, on the lower lip. Things like that can be because they've been in the sun quite a lot, and they get these what are called rodent ulcers. And these things occur anyway, but all you do is say to the patient, you've got a little ulcer on your cheek, how long has it been there? And if they say anything over 3 weeks, 4 weeks, start getting a little bit suspicious. So I've seen there are no blemishes, there's nothing going on that I can see here. So what we're going to do is I'm just going to ask you to do a few things for me. I'm just going to feel around the face, if that's okay. So what I'll do now is approach from behind the patient, and this here, the patient's a nice height, it's just underneath about the crook of my arm, and I'm quite relaxed and she's quite relaxed. And what I'm going to ask her to do first is I'm just going to palpate for the TMJ. And what I'm going to ask the patient to do is open and close. And close. And what I'm feeling for here is when the patient opens, I can feel the TMJ, and you can feel the condyle moving out onto the articular eminence. And what you're trying to feel for are little clicks and signs that something's not quite right. Patients will know that their jaw clicks usually. So you just open and close again. Nothing going on here. There's a very, very mild little interference click here, but it's nothing outrageous. And the other thing you can do is just say to the patient from the front, if you just open and close, and watch for the mouth, and if it deviates, and in line with the jaw opening and closing. Having established there's nothing going on with the TMJ, what I'm going to start doing then is feeling for lumps and bumps underneath the skin. And what I'm going to do is start by feeling around the auricular area, here, just behind the ears, and put a little bit of pressure just to palpate and just to see both sides at the same time. Wherever you feel on the right, feel on the left. Because if things feel the same on both sides, then there's usually no problem. If things feel different both sides, then there could be. We know that there are lymph nodes in the auricular area, and we also know there are lymph nodes around the buccal area and the submandibular area. So that's where we're going to palpate. And we're also going to palpate these glands, the salivary glands. And we've got the parotid, we've got the sublingual, and we've got the submandibular. And what we're looking for is evenness. Two little areas down here. One is the notch of the lower border of the body of the mandible, where we know that the facial artery comes through. And just in front of that, underneath, you'll find there's a little lymph node. Now if you feel it, something wrong with it, because usually you can't feel it. Oh, you can't feel that. And then you move up to the submental and canal angle, canal region, where there's a little lymph node just under here sometimes. And what you're looking for is raised lymph nodes. And there's nothing there. And then you move back to the angle of the mandible and you palpate with two fingers and you can palpate the musculature of the neck. And if you drop into the little fascial planes between the musculature and drop down, what you'll reach are the jugular lymph nodes. They're just under here. And there's nothing going on here either. And then down to about the midline of the neck. And that's about as far as you want to go. And if you've reached nothing by then, you're probably fine. And that, in essence, is the end of the extraoral examination. And from anywhere from here, we start to look at the lips and the tissues of the mouth.